Hello, 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 everyone. Good morning. Good morning. We have a special event today, and I'm thrilled and truly honored to have both of my amazing guests on. You know both of them, and if you haven't known both of them, you're going to know them because they are inspiring, courageous, heartfelt, authentic, sincere, intuitive, and amazing women. Um, I I step onto this path inspired by these two people. Their education, their advanced knowledge, and their wanting to know. I love both Ginger and Lisa because they both want to know the whys, and they do not settle for the no's. They don't. They keep on going until they get their yeses. And sometimes kicking and screaming, sometimes, bring it on. They both have these warrior attitudes, which I just love. And I'm honored to have them as soul sisters and friends. So please welcome my friends, my soul sisters, Ginger Healing Heart Medium Peric and Lisa Nolan-Chalowski. Thank you both for being here.
Hi, good
Good
morning.
morning to both of you.
Hello.
Good morning, good morning, good morning. Let's first say hello to everybody and see who's here. Joyce says, I will watch the replay. I really wanted to be here for this. No worries. Good morning, Carson. And good morning, Michelle. Good morning, Cindy. Hello, Ellen, Jane, and Jean, and Dina, and Denise, and Cindy, and Beth Rogers. Good morning. I enjoy them both. I do too. And Diane Sims, good morning, Sister Sledge. Michelle, good morning. Beth says good morning. And Sarah May from the UK, good morning, Ginger, Lisa, and Elias, sending love and good positive vibes to all. Thank you. And yes, Carson, thank you. YouTubers, please remember to like and subscribe. It truly does help. So thank you all for being here. This is a very heartfelt talk that we're going to have today. So y'all know that all three of us can yuck it up when we need to. And we probably will a little bit today.
Mhm.
But we wanted to talk about cancer. And we wanted to talk about how the both of you, Lisa, being post-treatment and going and having to go through all that, and I know we've had you on a live before, and you so eloquently explained your journey, and now Ginger about to step on that journey. How did you, well, I'll ask you first, Ginger, and then I'll go to Lisa. No, you know what? I'm going to switch it. Lisa, I'm going to ask you about the intuitive piece. I won't ask Ginger. What did you feel? What did you like? You got it. And did you know prior? Did you have a feeling prior?
So it's interesting. I had a dear friend of mine, Mark Sharilla. He was a chiropractor, and him and his wife were just very dear friends. I was a bridesmaid in their wedding, and he passed away. I believe it was back in 2016, and I was diagnosed with cancer in 2021. But a couple of years prior to my diagnosis, I had a dream, and I think I've talked about this dream where Mark took me to the other side. I went into like an office building. There's all these people sitting in cubicles on one side, and then there was a wall. And then we walked down this hallway where the wall was separating all these people. and we met up with another gentleman, and they pulled down a screen, and Mark and I start watching this video of my life unplaying. And one of the things that came up on the screen was I was to have pancreatic cancer. And I remember turning to him and looking at him because my cousin's first wife passed away from pancreatic cancer. And I remember saying to him, now, wait a minute, I know that's usually a death sentence. And I realize I have to have the cancer experience, but is there some other way that I can have it besides pancreatic? He looks at the gentleman that was running the demonstrator, the video or whatever, I was watching. And they simply nodded their heads and said to me, "We'll see what we can do." And that's all I remember of the dream. And then when you fast forward 2 years later, I had always had breast exams that had fibrous tissue, right? And at one point in my life, many years ago, I was even on kind of a watch list. Got to come back every 6 months because it's, we just want to keep an eye at it. So in February of 2021, I had my routine mammogram. No changes, nothing wrong, right? See you in a year. And then that fall, we had the fire in our condo on October 27th, I think it was. And then 3 weeks later, while we were living in the hotel, because we hadn't even found permanent housing, I found a lump. And I come out of the shower and I showed it to Patrick, and he's like, "Well, we're not going to worry about it right now." Actually, we were at an event. We were actually at a thing called, back then it was called the Victory of Light. Body, Mind, Spirit Expo has purchased it. And so we were at the hotel. I had gone through my whole first day of readings, found the lump that evening, come out. Patrick's like, "We're not going to worry about it. We're just going to get through tomorrow. And then you call the doctor on Monday." And got through the next day. Just, I was like, divine spirit, holy God, whatever I was calling on at that time, and got through that day. And then the next day I reach out to my doctor. Of course, she has a concern. She gets me in the next day, and she couldn't find it. So I'm laying on the table, and she's palpating is palpating the right word, Ginger? She's, palpating and trying to figure out what I'm talking about. And I said, she goes, "Well, you pointed out to me because I can't find what you're talking about." And when I took her hand and put it on the lump that I had found, like all the blood drained out of her face. And she says,
Wow.
"Okay." She goes, "I'll be back in just a minute." So I'm like, all right. And then her medical assistant comes in and says, the doctor wants to get you in right away for, mammogram and ultrasound. And we've got that scheduled for tomorrow. Now, tomorrow was the day before Thanksgiving. And so I wasn't thinking much about it. I didn't think about taking my husband with me. And so I go and I do my normal, mammogram. And the women who do the photos aren't supposed to respond in any way. Technically,
Right.
I don't even think they're supposed to show you. And but the way it was set up and the way I kind of positioned myself, I was like, "Can I see?" Right? Like the way they had the camera and the way that, I don't want to get this young gal in trouble because it absolutely was not her fault. I was like, "Oh, well, that doesn't look like that belongs there." So I'm still trying to keep myself upbeat. Okay, let's just, may not be anything. I don't know. I'm not a medical person. So they take me over to ultrasound. Same thing happens. Lady's taking a bunch of pictures. And I was like, "Well, that's good. She's taking pictures." And then she's measuring something. And I was like, "Well, obviously she's, measuring something for a reason. We'll just kind of lay here and work this through." And she goes, "Wait right here. I'm going to go check with the radiologist and see if it's okay for you to go." Well, in comes the radiologist, and she sits down, and that's, never a good sign. And and it literally looked like if you couldn't envision a walnut with 3 little fingers growing off of it. So literally a fist, and then these 3 little fingers. And she said, "Normally when we see something like this, it is always cancer. And, the concern is these 3 little fingers are like, it's growing."
Mm-hmm.
She said, we're gonna, I kind of blacked out at that point. I'm thinking to myself, what the F-U-C-K is happening to my world right now?
Yep.
Okay. There was no intuitive, enlightened person sitting there on that table at that moment. Okay. So I'm just going to be real with you. So they moved me across the aisle. There's a lovely nurse practitioner that sits there with these lovely little pink bags. I was treated at the Stephanie Spielman Center, which is phenomenal care. But she sits me down and she starts going over, okay, they want to do a biopsy. We're going to send you away with this information. Da, 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 da. Everything's very quick. It's fluid. I mean, it's just like, and so I go walking out with my little pink bag full of you have cancer information, and I get to the car. And I called Patrick and I literally just lost my shit. I mean, sobbing, convulsing, crying, like, what? You know what I mean? It's like, ah. Yeah. Breathe for me, guys.
Yep, we're breathing. We're breathing, honey. We're breathing.
I'm trying not to cry with you, Lisa.
Ooh, wow. This is 2 years. This is almost what? 3 years later? 2 years later? Anyway. But that was all. I was already in an emotional state because I wasn't even living in my own home because we'd had a fire, right? So all of this is crashing down, and Patrick's like, oh my God, if I'd have known, I would have come with you. And I was like, yeah, if I'd have known, I'd have had you come. But it's all like in a contained only women environment anyway. So he wouldn't have been able to come back with me. But then, that's where the journey began. And one thing after another, I was diagnosed. So I had my biopsy, and that was done on December 6th. And that's when the official diagnosis came in. And then and then, you're sent over to plastic surgery, and they talk to you about what they're going to do. At that time, I was scheduled for a lumpectomy, and they were going to reconstruct both the breast based on where my lump was and how they felt the breast would be deformed. So I was supposed to have the lumpectomy, and then immediately following, the plastic surgeon would come in and he would reconstruct both the breast. And that surgery was scheduled for like the third week of January. And my husband came down with COVID and he gave it to me. So that was my second time having COVID. So they postponed my surgery. And when they postponed my surgery, the next surgery date I could get in was, which I love, was February 2nd, 2022. So it was 2/2/2022. So I knew, right? Because I'm a numbers girl. I'm not a numerologist, but I'm a numbers girl. And I was like, all right, this is going to be all right. They got me powered up on a 2/2/22 day. And I know I'm in the hands of God, and I know this is going to be good. And so I had the lumpectomy, but they weren't able to line up the plastic surgeon. So that was going to be after all of my treatments. And Spirit works in miraculous ways. I ended up not needing reconstructive surgery. So, was that why I got cancer? Was that why I got the COVID? So that it would be postponed and, everything, So sometimes things don't always go as planned. Mine, it seemed like everything was a delay. Everything was a delay. And they would say to me, we want to get this out of you as soon as possible. We never want to wait more than 2 months. And I'm like, look, this is all right. It's like the end of the 2-month mark, right? Like, what are we doing here? So then you're in those pauses with this energy in your body that you want out right away. And then you have to learn to be like, okay, how am I going to move through this? So, I still worked the whole time I was going through all of that because I found power sitting in spirit. And when I was in that power with spirit, I feel like I was healing me. So I never gave up my service to spirit.
Sure.
And I never once, not one single time, said, why me? Because I knew from that dream that I had a couple years prior that this was coming. But for some reason, between my husband and I, we always knew I was going to be okay, but it was going to be difficult, right? It was going to be difficult. And then the day came that all the procedures are over, and then you go and you get your what they call an oncology score. Anything higher than a 25, they recommend chemo, and I was a 26. You know, I have a dear friend of mine that was a 76. I can completely understand chemo for a 76, but a 26. And I'm sitting there, and we simply just asked the doctor, if this was your wife, what would you have her do? And he said, I would have her do chemo. So that's what I did. You know, they said in about 16 or 17 days, your hair will fall out after the first treatment. And I was like, all right. And I can remember the day I was warned. I was told by people that, you know, go ahead and cut your hair shorter because it's going to be alarming when it starts falling out. You'll wake up, it'll be laying on the pillow. It wasn't that dramatic for me. It wasn't. But it was just one day I kind of twirl my hair all the time, and I twirled it and I was like, oh, I don't think I'm supposed to have that much hair in my hand. And I kind of laughed and I said, Patrick, I think it's time. So he did the duty for me, and he, you know, we videotaped it. I've never gone back and watched it. It took us probably an hour to cut my hair because he kept breaking down, you know, and we would laugh and then he gave me the oh my God, what is the president? There's a president that had there's the somebody that was like bald on top, but then only had like the hair across the bottom. So he was giving me these really funny haircuts and then taking pictures of it along the way. You know what I mean? It was just like, it was completely ridiculous, you know? And I was just laughing my ass off because it looked like, imagine me putting like a bald cap on and then only having like the bottom half of my hair hanging down as long as it is.
Oh.
And we were laughing, and then we'd be crying, and I'd be like, you have to take a picture. You have to take a picture, you know? And yeah, I mean, and then I never got fitted for a wig. I never felt like I wanted one. And I just walked around proud as a peacock. And then, you know, I would help people feel comfortable with me by telling them they could rub my head for good luck. Right. I mean, because most people, when they see a woman that doesn't have hair, they know she's going through something. And everybody was so kind. And then people would see me and they would talk to me about journeys that maybe they were on or had been on or had a sister that was on or, you know, a mother or, you know, so it really invited people to open up and heal through conversation even deeper, right? Even now, I'm still healing through conversations that I have with people and being able to help them where they are. And I hope that I've been able to do that for Ginger so far. But yeah, so then after my chemo, I had some hiccups with that. And then I was able to get through 2 of the 4 treatments, and they said, well, we're going to leave it at that. I heard Spirit say, we gave it the 1-2 punch, and we're good. You know?
Okay.
I will say, for anyone who's ever going through chemo, a dear friend of mine who also went through cancer, but a different kind, she gave me a visualization technique, and I absolutely believe that this worked because I saw it in my mind as I was having she says, as soon as you're hooked up and as soon as they start moving that chemo energy through your body, see it as little hearts with swords and shields and just whacking away at any of the cells that don't belong in there. And that's exactly what I did. And I literally was giggling as it was going into my vein, right? I was literally giggling. I was like, oh my God, there they are. They're marching away and they're just slaying all the nasties that are in there, right? Like, so that's how I got through it, right? I was just working with visualization, working through just connecting to spirit, channeling, just staying focused. Now, was I able to do that every day? No, I'd be lying to you if that was the moment. But I anchored myself in spirit, and then I had taught myself how to carve. So I whittled my way through cancer. I was whittling all kinds of stuff, making gifts for my mom and gifts for my family for the Christmas that was coming up, and then I had my radiation treatments, and the journey was over. And then the journey began of growing my hair back. And, a friend had told me, she said, after my treatments were over, she said, this time next year, So my treatments were over at the end of April. She goes, this time next year, you'll actually have hair that you can style. And I remember thinking, style? What do you mean? It's going to take me a year just to get hair that I could style? So I used to celebrate every little hair that came up, I would celebrate, I should have, looking back, put little ribbons on them and having pictures taken, but, but that's, it's, guys, it's not, I don't mean to make light of this, but, you have to find ways to not let it overtake you or let it become everything you are. It's the best way I can describe it. So I had a lot of, a tremendous amount of support. I did not share my journey on Facebook. I did not share it anywhere. But if I were talking with a client, or if I were talking with someone on the street, or talking with people in my friend circle, everybody knew. I just didn't feel like I wanted to share it that far out, right?
Sure.
I didn't want any judgment of what I was doing, how I was doing it, when I was doing it, where I was doing it, and people can, I will say there was someone in my close friends sphere that begged me to go alternative in my therapy. And I was like, I have seen people go completely alternative. I had a dear friend that went completely alternative, and they're not here to talk anymore. So my choice was, I balanced it. I did some alternative stuff, but I did, my belief is there are higher powers that are giving the doctors the hands to heal, the medicines to, eradicate these diseases out of the body for whatever reason they show up. I believe it was a soul contract that I made, that this was an experience I was supposed to have. And now I am a walking, eating, breathing, living testament of being a cancer warrior, that I can help other women, empower them, know that they can get through this, and, just be an ear, right? Because, I know Ginger has called me and she's like, I just need to BITCH. I'm like, I'm your girl. Bring it on me, because I know what that feels like. So, yeah, so that's pretty much in a nutshell.
And Lisa, there were times for you that, because I know that you and I chatted during that you're like, I'm not talking to many people. You didn't want to. You needed to go within. And I just have to ask, Ginger, does this, hearing Lisa, and I know you've
and then
heard
here's
this,
my fun T-shirt that my girls got me when I was.
I love that. I love that. Hearing Lisa's story, does that give you hope, strength, possibilities, that she's on the other side now?
Oh, I know I'm going to make it through this intuitively. I know and Lisa spells words out and I just say them. So there's a big difference between Lisa and I. I'm going to kick its ass, and I'm going to get through this. Lisa and I have talked about this. I know this is, and it sounds somebody, you don't get cancer for a reason. I think as a person is spiritually connected as Lisa and I are, I think there's a reason behind it. Exactly what it is right now, I don't know. Does it piss me off? Yes. I know this is.
Sorry.
No, that's okay.
You're fine. You're okay.
Lisa. I got blindsided by this. It completely blindsided me. So it caught me off guard. So I talked with Lisa also while she was going through this. I called her and checked in on her. I know that she went radio silent, where I would text her and say, I'm just thinking of you, sending you lots of love. And I wouldn't hear anything back, but I know she saw it. And I know she was in a place that she was just like, I have to just go within and work with myself and just not answer back. And I know I'm going to probably do the same thing, just because that's how we deal with things. So yeah, it does help that to know that she's going to make it through it. I know I'm going to make it through it. Is this a, what is the word I was telling Brad this morning? This is scary. This is a lifelong thing that has to be taken care of and has to be watched for the rest of our lives, or, or there's a chance that it can come back. So, that's something I don't want to give that any energy, but yet, and having a medical brain, that probably makes it worse for me than what Lisa went through, because I already know all this shit. I already know the possibilities. I've done all the research. I've been on all the medical journals, because that's how I feed my need to know,
And if you guys don't know, Ginger is a nurse. So, I mean,
So I guess I could kind of start off with how I found out, how intuitive
yes.
I found out. So that is funny. I had my last mammogram in 2021, also in January of 2021. And my mammogram in January 2021 said that I had very dense breast tissue. It suggested I have a follow-up. At that, I don't go to this doctor any longer. He just said, oh, it's normal. I think at that time, and I can't do the shoulda, coulda, woulda, and I'm not going to do the finger pointing. I just think, had he said, let's do another one in 6 months, or let's do an ultrasound, maybe, just maybe. But I can't do that. A lot of people point fingers and find fault. But as a medical person, I try to find the answers and look and go, well, so, and how my journey started off is I'm in menopause, and I've been in menopause, it seems like, all my life. For like 15 years, I have struggled with hot flashes and mood swings and all of the things that women go through in menopause. And I had decided that I wanted to try to take bioidentical hormone replacement therapy, because the hot flashes and the mood swings were driving me absolutely crazy, and the brain fog. Especially in the medical field, having to talk to somebody and not even be able to remember a name of something, and looking like stupefied while you're standing there you can see it, feel it, taste it. It's on the end of your tongue, but the words won't come out. So I thought, well, maybe I can go to a naturopath, and I love my naturopath. Absolutely would highly recommend him. And get some bioidentical, try to keep it, I was told bioidentical. So I had started 2 years ago, bioidentical hormone replacement therapy. I had also gained a lot of weight going through menopause. I have most recently lost about 35 pounds. So, and of course, as women, we all know the first place we lose weight is in our boobs. So I had been noticing a change with the way that they felt when I was doing my self-exams. And in the shower, again, I found this lump at Easter. Oh, by the way, happy Easter, Elias Patras. This is Orthodox Easter for Elias, and he's doing this on his special day today, and thank you. I had also found the lump, and it was on the weekend. It was on a Sunday morning. I found the lump when I was in the shower. I'm like, what the hell is this? It doesn't, I'm feeling around and I'm checking. And I think, Lisa, yours was just in one breast, correct?
Correct.
I have it in both breasts. So double whammy for me, right? So I found it on the right side. The left side, you can't feel. It's up here in the right or left upper quadrant, or part of my breast. It can only be seen on ultrasound or mammogram. So I'm panicking, thinking, crap, I have to call my doctor. So Monday morning, minute that phone's open, I'm on the phone. I need an appointment. I found a lump in my breast. I'm really freaked out. I'm menopausal. I'm on bioidentical hormone therapies, which puts you at a risk over my age. At my age, it puts you at a risk. And the medical assistant, bless her heart, says, okay, well, let me talk with the doctor. And hi, Liz. Yeah, and they give you such conflicting information. They do, but that's not saying that it's not good, Liz. It's with your genes that you have. You have the gene that could set it off. So I call, and the medical assistant said, well, let me have the doctor call you back. Now, I called him at 7:00 in the morning, and I've been known to be a bull in a china shop, and my patience is about this much when I set my mind on something and I want it. So 3:00 in the afternoon, I get the call back. And we can get you in. Okay, good. I'm off tomorrow from work. I can come in. And they go, no, he wants to see you next Tuesday. I go, next Tuesday? You're going to make me wait a week to have this checked? There's no reason. It's there. I can feel it. Just give me an order and let me go get a mammogram. Now, in my insurance, we can have a screening mammogram every year over the age of 40 without a doctor's order. Screening mammogram. If you find something and you call and say, I found a lump when you order your mammogram, and this is just a way around the system, it's probably not the correct way, and I'll probably take slack for it. Don't tell them you have a lump. because they'll say you need a doctor's order. I can understand why, because the doctor can do they can check you and order specific screening for that. But I wasn't going to wait a week, so I called. I got upset on Monday. I got up the next morning. I was sitting outside watching the sun come up, and I thought, okay, universe, God of your understanding, please give me a sign on what I should do about this. Should I wait, or should I find another way to get this done? And then I heard, call this facility. And I thought, oh, okay. So I got on it was like 7:02. I called this facility and I said, hi, I'm going to schedule a screening mammogram. Do you have anything available? She goes, well, let me check. She goes, can you come in today? I said, sure, I can come in today. She goes, how about 8:30? So it was like an hour away. And I said, absolutely, I'll be there at 8:30. I jumped, got in the shower. Of course, you have to clean off everything because you can't have anything on. Jumped, ran down there and told Brett. Now, my husband, I told him I found a lump. I was mad and freaked out that I couldn't get into the doctor. I showed him the lump, what I found. And then I went and got the mammogram, and then I left and met him for breakfast. An hour after I had left that facility, I got the phone call from the radiologist saying they wanted me to come back in for more imaging. But I knew that lump wasn't a normal lump. I knew by the way it felt. I knew by where it's located in your breast. It was not normal. If you want to figure out, y'all get on and learn about your breast. Look up, I have invasive ductal carcinoma, which means my cancer is in my milk glands, the ducts that produce the milk. So I'm not sure, Lisa, where yours was. I think it's the same.
It was exactly the same cancer.
Yeah, exactly the same cancer. So if y'all want to just, it's informative for you to not only learn how to do your self breast exams and do them every month. It isn't just about feeling your breast and saying, oh, I don't feel anything. You have to physically look at your breast in the mirror, and you actually have to lift your arm up and look in the mirror at your breast, because I hadn't done that month or in a couple months, and I had lost weight in my breast. And after I found the lump, I lifted my arm up, and there was the indentation that I hadn't felt, but it was there. I could see it. And that's when I knew the indentation is usually a sign that you have some type of growth in your breast, whether it be benign or cancerous. So I scheduled, now my doctor had scheduled me out on April 2nd. I got back into the radiology facility in the morning of April 2nd. My afternoon appointment with my physician wasn't until 3:30, I think. Went in that morning at 8 o'clock. Brad went with me, my husband, and we went in to have further imaging, which was more images and an ultrasound. And so they did all of that. And they took him in a room and sat him down. And they were really, really good as far as explaining what's going on. And then they came back in and got both of us and took us in a room and said, you have something suspicious for cancer. Now, Lisa had said she was trying to look at her screen. My tech wouldn't let me look at the screen. I said, can I see what you're doing? She said, no, that's HIPAA. And I go, I get it, but this is my boob. It's my boob. Why can't I look at my boob? But I understood she was only following the directions. She was doing everything the way she was supposed to be doing it and following the rules and regulations of HIPAA. So when we went back after the doctor came into the room and said, you're suspicious for cancer. We want to do some biopsies. What are you doing today? I go, nothing. She goes, we can do it right now. I said, absolutely. So went back and got the biopsies, joked around with them when they were making, when she'd snip, I'd say, oh, good job. I didn't even feel that. And I was joking with them, but I'd ask the tech if I could see while they're doing the biopsies, can I watch? And she just looked at me. She said, well, I have to turn the screen so the doctor can see. And I'm thinking, perfect. Now I can see. And I did. I looked up at the screen and I saw this hollow little black round amoeba-shaped tumor in my breast. And I said, oh, shit. And she goes, that's all she said was, I knew what it was because I've been in the medical field long enough. I've seen multiple abnormal mammograms, multiple scans of all different types. And I knew exactly what I was dealing with. And then we got done. The doctor said, great. They give you ice packs, by the way, that you get to stick down in your breast in your bra to keep everything nice and cold. That's fun. And then I went to my doctor's appointment in the afternoon, and of course, everything is joined together on my patient portal because I go to One Pacific Health company. And he looks, he goes, wow, you've been pretty busy. I said, yes, I have. He goes, you've already had your images done. And I go in biopsies, and the radiologist says, I'll have the results back by tomorrow. He goes, oh, I don't think you'll have them back by tomorrow. I said, she said Wednesday or Thursday. I said, I trust that's when they'll happen. And he goes, well, I guess I don't need to examine your breasts. I said, no, they're pretty tender right now. He goes, I can't believe you got done that fast. I said, I don't like to be told no. I said, and your medical assistant needs to know that when a woman calls and says she's found a lump, and don't put her off. That, if anything, at least order a screening for her, get her in and start letting that, because we turn in our heads as women. We know that especially breast cancer is something that, I mean, ovarian cancer usually doesn't show up until, the late stages, by the time you figure out what the symptoms are for that. So if you have a family history of it, please learn about that. Breast cancer sneaks up on you and blindsides you because it usually is deeper than where you can feel. And by the time you can feel it, it's already past its stage 1 going into stage 2. And there's 4 stages of breast cancer. So you were 2. I'm 2 on this side and I'm 1 on this side. So I caught it early. And I think because I did push and I didn't take no for an answer, and because I did push through to things, I feel like I got a head start on everything. And he said, well, I'll call you when I get your pathology reports. I said, okay. So I had gone out with my husband for the day out to Arizona Bike Week. I was out at Scottsdale for that. And at 3:00 in the afternoon, my phone rang. He said, wow, you were right. I've got your pathology reports. And I said, and? He goes, you have breast cancer. I said, I know I do. He goes, I can't believe you got it done this fast. I said, well, I have a way of getting around in the system. You just have to be your best advocate. You are your best advocate. And Lisa knows that. You have to stand up and you have to speak up, and you can't just roll over and just say, well, this is the only way I can do this, because there are lots of doctors out there and there are a lot of facilities. And if your insurance allows you to go different places, please do. Don't let someone, I mean, I love my doctor. It wasn't him. It was just the system that slowed me down in being able to get in and get things done as fast as I wanted to get them done. I don't believe in waiting for anything like this. So he's told me I will refer you to, and because I live in Arizona, we have MD Anderson here. And he said, I'll get a referral to MD Anderson and they'll call you. And I'm not kidding. That night, like in an hour after I talked to him, I had a phone call from MD Anderson, and they were setting me up for all of my appointments. So it's been, I know it's there, but it's not real completely for me yet, because I'm just going through the biopsies and the ultrasounds, and now I have to have another biopsy. My scheduled surgery was supposed to be for tomorrow, because I have one up against my chest wall that they can't get to place a clip, so they can find it to place the radioactive seeds in there to check my lymph nodes. I have to have another MRI tomorrow, and then my surgery's not till the 20th of May, which is hard because I'm fluctuating back and forth between I got this, I don't got this, I got this, I don't got this. It's, I have breast cancer. Or no, I'm not giving it any energy. Oh, I'm scared to death. It's an emotional roller coaster that's difficult. And my poor husband, he's taken a blunt of a lot of things. And I'm no longer on hormone replacement therapy because I came back estrogen and progesterone positive. So that means that I can no longer have any hormone replacement. So it's throwing me back into menopause again. And then I get to take an estrogen blocker for 5 to 10 years. So it's kind of wiping out my female is what this is doing.
Yeah.
So, yeah.
So what, so one thing, I've just been taking notes while one of the things that, most of the doctors, nurse practitioners would say to me is, please don't research this, Lisa, because no 2 cases are the same.
They're not.
But Ginger, being a nurse, has already done the casework for the last 30 years. So so those 2 things are a little different. One other thing that they do is genetic testing. Mm-hmm. And I would strongly encourage people to make sure that genetic testing is done. And even if there's just cancer in the family, I mean, I think it was like $250 to have a genetic test for my family, because I ended up having a thing called Lynch syndrome. I didn't have the BRCA, which I don't believe you have BRCA, Ginger.
I have my genetic testing done. I have a half niece that was BRCA negative, but I don't know.
You don't have the answers yet.
And by the way, for everybody, I have no family history of breast cancer on my mother's side. My father's side, yes, not on my mother's side. So we have pancreatic cancer, we have non-Hodgkin's lymphoma, we've got lung cancer, throat cancer, all the other cancers. No, so I never ever thought that I could get breast cancer. So and that's why I was taking the hormones, because they say, do you have a family history of breast cancer? No, I don't.
Hormones,
Guess what? And it ends up, prostate cancer is a genetic precursor. If you have someone that has a lot of prostate cancer in your family, I found this out from my geneticist when they did the full workup, that if there's a lot of prostate cancer on your paternal side, it puts you at a risk of breast cancer for yourself, because they're genetically similar, and that stuff. I did read things with a grain of salt, so to speak. I read a lot of things. I wanted to know the percentage of survival rate. I wanted to know what causes it. I wanted information to allow me to make informed decisions from my healthcare, because people just not having the knowledge and not informing yourself allows other people to make those decisions for you. And that should not happen. You have control of you and your decisions, and maybe a couple good friends around you that have been through it, or, have some knowledge. Don't allow people to run your treatments or anything for you. Be informed.
Yeah.
Susan says, knowing the stages is so important and screenings are vital.
Mm-hmm.
Liz totally agrees. She also said for her 36-year-old daughter, screening the next day and biopsy following day, because we pushed hard.
Mm-hmm.
Stephanie said, at least you got to talk with your doctor. I had thyroid cancer, and the nurse called and blindsided me on the way to work. Liz says the mental and emotional trauma is real. Environmental breast cancer.
Yeah.
And this is, thank you, Liz. This is a great conversation. You're welcome.
One of the things too, that now that you have a little bit of time, Ginger, between when your surgery is going to be, because I thought it was tomorrow.
I thought it was too.
This was, and I'm certainly not saying you have to do this, and you may think I'm completely crazy, but
I think you're
anyone in my friends group, or I teach out of a place called the Reiki Center here in Columbus, and my husband's cousins and my family and my mom, and I was like, you want to feel it? You want to feel it? No, because I'm like, I wanted women to know what to feel for. I wanted them to know what to feel for and where it could be. And I was always whipping that thing out and showing people where it was and having them feel it, and just, educating on a level of, here it is. I'm going to have it for
how large was yours, Lisa? How large was yours?
It's size of a walnut with 3 fingers off of it. I don't remember the exact numbers. I too was estrogen and progesterone positive, but I was HER negative.
Same here.
That was.
And you learn a lot about that if you do a lot of research. You
learn about that stuff. And then I was proactive and went ahead and had a full hysterectomy the same year. So all of my my surgery, chemo, and radiation was all done in the first half of the year, and then for Christmas. December 21st of that same year, for Christmas, I gave myself the gift of a full hysterectomy. And in speaking from someone who is in the post stages of this now, I am now in the estrogen blocker phase of this. I started taking my estrogen blocker. I looked at the date the other day. It was in 2022. I don't know, it was like May or June or something. And my body, I'm showing all the signs of a woman who's on the way back end of menopause. Like my skin, I have to see a dermatologist every year for my skin. I have to have a colonoscopy every 18 months. I have to have an upper endoscopy every 3 years because of having Lynch syndrome and having had cancer. Now I say have to have, I don't have to do anything.
It's
I
being proactive, though.
it's,
You
it's
choose.
I
Yeah.
choose to because that's
Yeah.
what they recommend,
Yeah.
right? So I'm just so we're looking at this from this is Ginger. She's just now in the beginning stages of this, haven't had surgery yet. I'm on the way back into this. I'm a couple years out and looking at this from, my mental, spiritual, all of those different things that I have done to just keep myself motivated because
Mm.
not everyone um not everyone would want to share their story in this way or as public as we are. And certainly if there's any women out there that are having a challenge or having a problem, I've got the best bras, because they were recommended to me, and I've got the best, cutest little beanies that I've already sent links to Ginger. If in the event chemo has to be part of her treatment, this is going to be something that she can wear. Actually, you know what? I didn't send them to you. I sent them to another friend that's going through it. I
Oh,
said, we're not going
see,
to. Was it
I'm
you? Because I said we're not going to project chemo on you, but I
no,
have another.
I am not putting any energy into chemo whatsoever. I saw the oncologist. I mean, they hook you right up with. I went and saw my surgeon. Love her. Love, love, love her. I'm supposed to have bilateral lumpectomy. She thinks she can get all of it. My tumor in my right breast is the size. There's 7 of them. I shit you not. There are 7 of them in there, and they're all together about the size of a breakfast sausage in the right lower quadrant of my breast. And I will let anybody within reason, the friend wise, feel that if they want to see what that feels like, because it just feels, kind of lumpy, bumpy, but when you know what you're feeling for. But and then they send you to the radiology oncologist, and they talk about having radiation 5 days a week for a month. I'm thinking, okay, that's fine. And then of course I have to worry about work because I still work full time. And then the oncologist I see, and he says, well, if you have to have chemo, checking your onc score, I have to wait till after surgery. They take the pathology of what they take out of you, and they do this oncology score. At least this was 26. He told me 25 or less, depending on what they see,
Right.
chemo, no chemo. And I said, well, he goes, with, if your hair falls out. And I go, well, because I have, like Lisa, I have natural curly hair. He goes, oh, well, it'll come back straight. I go, oh, hell no, it's not going to come back straight. I will cry if my hair comes back straight. I know yours came back curly. I said, my friend came back curly. He goes, well, almost everybody's comes back straight. And I said, well, that's bullshit. I'm not going to let that happen. Sorry. I love my curly hair. But, taking that estrogen that you're taking, that estrogen blocker, that was my little crisis cry this morning with Brad, was that I never had any children. So to me, my uterus was never anything but, just did its monthly thing every month because it never carried a child. So that part of my woman was never really utilized the way all women feel they should have. You're supposed to have children. Not everybody chooses that. I tried and couldn't. And then I'm thinking, well, and then I'm going to get my boobs all cut up. So that part of my woman, sorry if it's the truth, is going to be compromised. And then now I'm going to have to take an estrogen blocker to block that part of my female. Fuck.
Yeah,
It's like
with an estrogen blocker, your chinny chin chin hairs.
I've always had PCOS, so polycystic ovarian syndrome. That's why I always had a lot of hair on my arms. I always had to argue with the hair on my chin. My husband was teasing me this morning, saying we're going to have to start to shave you. And I think I might have said something rude back, but these are all things that I'm all looking at that's going to happen for me in the future. Trying not to give it too much energy, trying not to overthink things, trying to stay in a spiritual center, but my human's taking over, so my human's getting in the way of my spirituality, thinking this is going to be okay. Don't give it any energy. Don't feed it any more than you need to feed it. And I'm still struggling a little bit with that because I haven't had the surgery yet. And that's when it's really going to be real once they actually do that. And then I start then things are going to sit in a little harder for me. And I'm still going to try to figure out how to work as much as I can. Probably not as much as I will be able to, but I like Vicki said, but I am alive and I'm going to live every day and I'm going to make it through this. But oh geez.
So I think you're going to surprise. I think you're going to surprise yourself, Ginger, at how much you are going to be able to do.
Yeah.
For me and chemo, they managed me so well. You feel like you have the flu for 3 or 4 days, and then I was good, you know? And then you got 2.5 weeks of really good, and then you do another one. And then you prepare for there's 2 or 3 days that are going to be. And then one of the other things, and I don't know if this will be something that they will recommend to you, but in my post treatment, I'm on 3 years. I've got one more year left. Every 6 months, I go for a treatment called Zometa.
That's probably
And,
going to happen. Yeah.
and Zometa is something that, because of the estrogen blocker leaching calcium out of the bones, Zometa keeps the bones strong. And then I'm also on, I take a prescription of calcium and vitamin D because it's cheaper than buying over the counter.
How much
And
how much calcium are they recommending? That was the other thing. How, you have to think of, and I have a history of kidney stones, and now I have to take excessive
yeah,
amounts.
I want to
Yeah.
six. I don't know. I don't know the number. It's on
100
my
milligrams.
bottle.
Mine's
Um,
100 milligrams. Oh, we keep popping in and out.
yeah,
1,600 milligrams of
yeah.
calcium.
And Zometa is it it has its crazy. I mean, everything has a side effect, but I go into it again when I'm doing the Zometa treatments. I go in and I see those little hearts and those little swords and those little, those little armor. And I've not, my desk is fake wood, but knock on it, it's I haven't had any problems, right? I just haven't had any problems.
I have
And I want to mention this to everybody before our time runs out. I want to talk about, and I'm sorry to cut you off, Ginger. I want to mention that everyone, it's really important. It really is important to look at how you all are nurturing yourself. Breast cancer, remember, it starts out here, and then it goes here, and then it goes here. Remember, breasts symbolize nurturing. And if we, all of us included, all male, female, if we don't start nurturing ourselves first, the place that the dis-ease happens is in the breasts. Men also can get breast cancer.
Yes, that's correct.
Do you want to read a little bit of that from the our big fat book? Because I was looking.
I don't have the big fat book with me.
I have it. There's this big fat book, and I was reading it because I was trying to figure out, okay, physically, yes, I have breast cancer. Yes, I was at risk for taking bioidentical hormones over my age that I'm at. But then I wanted to look up and see energetically, because Elias and I talk about this a lot, energetically, where this comes from.
And it's everything that the three of us do. We talk about the energy of things. And if we can stop it, if we can shift it prior to this, I know that I have many female friends, and I had a client when I was living back in Chicago, and she had stage 2 breast cancer. And I know, for me personally, as an intuitive, when I can feel it on my body and I can pinpoint it, I know that there's something there. I knew where Ginger had it, because I'm like, is it here? And she's like, yes. And I'm like, is it there? And the point of that is that what this client nurtured, she had 5 sisters. She was the eldest. She was the one that did everything for everyone else. She was the one that supported her husband, supported her 2 kids. She would drop and run and go to the other sisters when this happened. She did everything and put herself on the back pilot light, or back, stove. She put everything on the back burner, is what I was trying to say, on the back burner. And I said, you have to put yourself first. And, thank the stars and everybody above that she is cancer-free. They removed the lump and the tumor and everything else. And it's been 6 years that she's been cancer-free. But every year she calls me up and she's like, do you see anything? I said, what do you feel? Have you been nurturing yourself? Have you been honoring yourself? Have you been doing things for yourself first?
Mhm.
So go ahead, Ginger. I'm sorry. I just really
No,
wanted
it's
to bring
okay.
that up because it's an important point.
And I'm number one. I'm number one. I have my entire life put everybody else first. I grew up in, and I'll share this, and I don't care who sees it or what they hear because it's just the truth. I grew up in an abusive alcoholic household. My mother never stood up for herself. My siblings, they did what they did their own surviving and my survival, but yet I was the one that stepped in and made sure that my kept my mother safe. So I took care of my mother from probably the age of 3 when I told her when I was in the hospital to go home, you look tired, to up until she died when I was 56 years old. So I spent my entire life watching out for, taking care taking care of her heart. She could have probably died 3 or 4 times, had I not stepped in and made her take care of herself, up to the point that she said, I'm tired, I can't do this anymore. But then I became a medical assistant, then I became a nurse, and I'm always putting everybody first. So this says you feel that you only be accepted in love if you accept responsibilities for everybody's well-beings. You might feel that the more you do for others, the more important you are. This comes from a childhood where you had to work hard for love and to be acknowledged. Love was hard to come by. Growing up in that type of an environment where the parents are at each other, you don't get that nurturing that you need. I didn't get the nurturing that I needed. Do I blame my mother? No. It just was what it was. It actually made me who I am today, strong and intuitive, and so there's no blame there. But I have always put everybody else first. If I had plans to go do something and someone was sick or needed something, they'd call me and I would drop my plans for my personal care and go and take care of them. There's a point when you do that and a point when you have to say no. And my new word for me is no. And no is a complete sentence because, as one of our long friends have taught us, my boundaries are sacred. And I've had to, since I found this in April, my boundaries are sacred. I will go and do things for people when I can, but right now I have to take care of me. And I've even told my husband the same thing. I'm sorry, but I may have to just tell you, I need to take care of me first. I will nurture and love you to a point, but you're going to have to help me get through this because this is going to be a journey. It's going to be a short one. I'm not going to let this be a long journey. Energetically, I have boxed everything off. It's not in my lymph nodes as of the last check. That's a big deal. And Lisa knows that.
Huge.
Once it gets into your lymph nodes, then they really have to go after it because that just is a highway. As my husband said, if it gets in your lymph nodes, he considers it, you might as well sign your death certificate. Well, that was kind of strong because a lot of people do make it out past that. So I wanted to share this. I know we've talked a while. I've been diagnosed with breast cancer. For those of you that don't know, I have not been doing my lives. I have not done a lot of readings, but as Lisa said, I think I'm going to continue to do my work and talk about this because it is still such a silent thing. And I'm on a Facebook group for invasive ductal carcinoma. And the stuff that I read on there is horrifying because of the women that are having to wait such a long time to get taken care of or don't know or don't understand. And they're so not as old as I am, but they're so young. And like I said, this blindsided me. Genetically, it shouldn't have happened. How it happened, I just can't beat it to death and try to figure it out. I just have to know the next step is Tuesday is my next biopsy. And after that, then I get my surgery. So Elias, I appreciate it. I didn't cry as much as I thought I would.
Yeah.
I had my good with Brad this morning, and
and I just want to add, for me, I had one of the most loving set of parents. Amazing. I mean, I absolutely had an amazing childhood, and my parents are still married, and I think they're going on 64 years. Very fortunate to still have them.
Mm-hmm.
So I don't have the typical wasn't nurtured. However, I was never able to have children, so I wasn't able to nurture.
Mm-hmm.
Plus, I'm always doing for others. Like I've always been a doer for everybody else. Take care of it. So that really does resonate with me. And there was always something in the back of my mind that women who never give birth have a higher propensity for breast cancer just anyway. So whether there's genetics in there or not, I do have a lot of cancer in my family. My maternal grandmother did have breast cancer and had her breast removed at 84. So there's always that chance. However, I truly do believe that energetically, if we take care of ourselves, if we're really listening to our body, if we're really paying attention, we can mitigate some of these things. And it begins with, women need to nurture themselves first, truly.
Oh, a sign they don't tell you about: itching in your armpits is a sign of breast cancer. Can be a sign of breast cancer. Like itching, like right in through there. I was having that.
Oh, for heaven's
was
sake.
having an itching, and I asked my doctor about it because I'm a pre-diabetic and I was overweight. They thought it was yeast. I go, it's not yeast. I know what that looks like. So they were just blowing it off. When I did some research, I found out that that is a sign. Also, an elevated CRP, C-reactive protein in your lab work can be a sign of lung, colon, or breast cancer.
Oh, for heaven's sake.
And that's usually when they draw for cardiac enzymes. I don't have cardiac problems, and mine was elevated. And I asked why, and they said, well, maybe because you got over COVID. I go, but that was 6 months ago. So question things, question, drive them crazy. Medicine,
and I'm going to
practice.
And I'm going to say this for the men that are watching the replay or that are on here. All your body is important. Your body is a temple. It is important to pay attention to it, to look at it, to honor it, to love it, and also to examine it. Men do not look at their, and I'm just going to say it, guys, I hope I don't offend anybody.
Yeah.
They don't look at their testicles. They don't, they'll compare them, but they don't look at them. They need to,
well, right? Majority of testicular cancer is found by wives.
Yeah.
Or that notice that there's something different because they seem to handle that more than their men do, and that's just
and prostate cancer as well. Ginger, please show, because guys, remember, this starts outside of your body first. It starts energetically. It starts spiritually. It starts with what you're giving and what you're feeding yourself and the energy that you wrap yourself up into. So this is another great book, The Secret Language of Your Body by Ina Segal, and Metaphysical Anatomy by Yvette Rose.
My big fat book. Yes.
Really good books.
And yes, testosterone does cause the turn into estrogen. And because I have PCOS, polycystic ovary syndrome, I always had elevated testosterone levels. So yeah.
And you had that itching for a year, you were telling me.
A year. And they blew, and I asked 3 different doctors. A year. Oh, and your immune system gets challenged. This is my stress. I got it.
Oh yeah.
I stressed out. I've only ever had one cold sore, and that was 10 years ago. And this was my stress level that I have, my internal stress level coming up. Sarah, oh, you're welcome.
You're welcome.
Yes.
Sarah.
And ladies, please, let's keep this conversation going. Everyone that's watching, would you like to have another conversation like this where we didn't get to do a little more of the Q&A, excuse me, which I like to do, but if you both are willing, we'd love to have you come back and do this. I think it's really important. Educating people, so important. And I think that is part of what we do on these lives. It's what all 3 of us do in our work. So
I will share my journey because this is scary. I'm scared. I am scared.
I know you are. And our prayers are with you.
Got this. Yeah.
You do.
We got you, Ginger.
We got you. And that's allowing us in, Ginger, and allowing us to hold space for you. That's another key piece, is allowing people for you to say yes to them, to allow the support. So please know the prayers.
So this is my lesson, to learn to ask for help. Yeah.
Yep. Exactly. Everyone, I want to thank you for being here. I know we went a little bit over. I thank you all for being here. We will be back again. And obviously, Ginger, prayers for you on May 20th and up to the journey, up to that date and beyond. Lisa, always continued prayers for you. Everyone else, thank you so much for being here. Remember, we are here to connect. And when we connect, we educate. And when we educate, we grow. There is unity in community. From my heart to yours. Thanks, everybody.
Bye.
Be well. Thank you. Bye-bye.
We dropped.
I think we're done. We lost Elias.
It says we're in the show and they can still hear us.
Oh, hi everybody. We're still here, Elias.
So we're just going to talk until Elias comes back, I
I
think.
guess we have to exit.
All right.
Brad's my
I'm going
husband.
to go ahead and exit.
Oh, should we just carry on without him?
Maybe we should. Maybe that's what this was meant to be. We're just going to carry on without him.
Oh, goodness gracious. Sorry, Elias. We kicked you out.
All right. Love
didn't get
you.
Thank you. Love everybody.
Hey, welcome back to your show.
See, we got to end in a laugh. All right.
It's a good thing we didn't say anything bad because we would have been live.
All right, because we're gonna end it now. Thank you so much. Thanks,
Is
everybody.
that Brad laughing?
Yes, it's Brad
Yeah,
laughing.
yeah, you know what?
Oh.
It has to be my kind of stuff, right? It's because I called you. I thought you were done. Yes, the phone was ringing. Great
Let's
sausage
stop
fingers. I'll
interrupting.
press whatever button there is.
Yes.
All right, everybody. Mwah. Love you both, and thank you,
Bye.
everybody.
I
I'm
love
going to do this again. Here we go.